proceed with questions. However, before I do that, I would like to make sure the record is clear regarding not just mental health services that are offered at the Hampton VA. We've pushed and will continue to push for veterans to receive the care we need it. That's why I've advocated for additional facilities in my district that provide these services. And in addition, and more specifically, that North Battlefield VA clinic in Chesapeake, I wanted to clarify and echo Secretary Collins' words about that facility. It's opening in deliberate phases to ensure safe, effective, and high-quality care as services and staffing scale up responsibly. While some public comments have mischaracterized this phase rollout, the facts are clear. The clinic opened in April 2025. I was at the ribbon cutting with 150 staff and core services, including primary care, mental health, and pharmacy. To quote Dr. Elliott, that was 27%, and it was always intended to expand in waves. In July, dental and additional mental health services came online, and by January 2026, the facility is scheduled to be fully operational with radiology, optometry, telehealth, and more. This is a standard and prudent approach for bringing a major healthcare facility online. As we grow more patients, we grow more staff. Spreading misinformation about staffing levels or service delays only undermines the hard work being done to provide the best possible care to our veterans. I remain committed to ensuring this facility and all our VA healthcare facilities reach full potential and deliver the timely, high-quality care the veterans in Chesapeake and across Hampton Roads have earned. In conclusion, and for clarification additionally from Secretary Collins, I'm pleased the Department of the VA is not going to pursue a large-scale reduction of force and have been reassured that any early retirements will come from redundant positions and non-essential personnel. This will safeguard operations at the VA and thus ensure services to our veterans. I'm confident that Secretary Collins will prioritize maintaining a robust healthcare workforce at the VA to ensure veteran care and benefits are not impacted. We can all agree that giving our veterans the care they need is essential. Under President Trump, I know that our veterans will be put first. In fact, the VA's performance has continued to improve under his leadership, with disability claim backlog already down nearly 30%. The work Secretary Collins is doing to modernize the VA's operations and get our veterans the quality of care they need is a breath of fresh air. By June, the VA had already processed 2 million disability claims, accelerated the implementation of the integrated electronic health record system, and made it easier for survivors to get benefits. These accomplishments on behalf of our veterans deserve recognition. And with that, I have questions, and my first question will be for Ms. Thurett. Ms. Thurett, the OIG found that the VISN quality assurance teams conducted reviews after the incentives were awarded. Can you explain why the VA's review process appears to be reactive instead of proactive?
Chairwoman Kiggans, regarding the VISN's review process, I'm going to ask Mr. Perry to respond to that question.
That's fine.
Thank you, Chairman, for that question. We agree where the VISN is needed to do a more proactive approach. We are shifting that responsibility over to the compensation aspect of the VISN to do that on the front end versus the back end. So we recognize that that is a gap in our process that we're making a modification adjustment to now.
And will the VISNs be talking to each other then to come up with a more standard approach?
Yes, overall, we are taking that approach to look at standardization. I think what we saw back in 2017, where it was down at the facility level, we had about 150 ways of doing it. We have made improvements that it's 18, but we do have some areas to improve to make sure that the 18 are doing it consistently according to policy.
That would be great. Consistency would be helpful. And I go back to Ms. Thurett, but either Ms. Thurett or Mr. Perry, would you please explain step by step how one of these 3 incentive payments would be approved, starting with the first step to the actual payment to the employee?
So, Chairwoman Kiggans, I appreciate the work of the Office of the Inspector General because their very detailed, actionable reporting helps us to improve. And we made improvements from the 2017 report and will continue to make improvements based on the 2025 report. So recruitment and relocation incentives are one category of 3 Rs. The recruitment incentive is to attract individuals into the federal government. The relocation incentive is to help move employees into locations that are hard to fill or where there's a specific need. There is a standard form 10016 that is completed for both of those incentives. One of the deficiencies in 2017 that we rectified in 2025 was that our department policy and procedures did not align with regulation. So now we have a department-wide policy, everybody should follow it consistently, and we have standard forms that every supervisor who's recommending an incentive, every HR official who's reviewing an incentive, and every approving official would utilize. So that's for the recruitment and relocation process. We have a similar 10017 that's used for retention. Retention incentives are typically shorter term. Recruitment and relocation can be up to a 4-year service obligation. Retention incentives, we typically look at a 1-year retention incentive service period. And the reason being, for retention purposes, we're looking at somebody who's likely to leave federal service and has a unique skill that we can't afford to walk out the door. And we need a short period of time to put that succession plan in place to either develop someone with those skills to step in when they depart, or to be able to recruit somebody before they leave. So that's the process and the steps from someone recommending an incentive for an individual under one of those 3 sets of parameters, to then HR reviewing the requirements based on regulation, and then for the approving official to sign off on it. Once the individual is identified, then they too have responsibilities. Signing the service obligation, making sure that they relocate if it is a relocation incentive, making sure they are new to the federal service if it's a recruitment incentive. And for retention incentives, we have a 1-year hard stop where supervisors need to review and recertify that that is still needed. Otherwise, it will be terminated automatically. So those are just some of the steps that we take with recruitment, relocation, and retention incentives, some of the things that we have in place, and where the IG has identified more steps that we need to take to have better oversight and compliance, that we are willing and currently in the process of doing that.
And that approving official, who is in their next step in the chain of command? Who would they report to?
Yep. So Chairwoman Kiggans, we have delegations of authority for our 3 R's incentives. Typically in the Veterans Health Administration, which is the subject matter of the report, a recommending official would be a medical center director. Approving official could be up to a network director. It depends on the percentages of the incentives that are being offered. Sometimes it's higher, but that's typically how the delegations of authority flow. Now, we also have breach of agreement procedures that we follow to make sure that if somebody does not fulfill their obligation, that we are going back and initiating and collecting those debts. Again, these are taxpayer dollars. We don't want to see these incentives misused or abused. I know there were instances in the report that were identified. We don't want that to continue to happen. The breach process is the individual employee who's asking for a waiver of repayment will go to their supervisor. That supervisor will take it the whole way up the chain of command to the Undersecretary of Health and the Veterans Health Administration. If they approve that request to waive payment, then it comes to my office, and our Assistant Secretary for Human Resources and Administration, Operations, Security, and Preparedness would be responsible for that process. So that's just an example of the levels at which these are reviewed and the seriousness with which we take things like breach of agreements.
Thank you for that very thorough explanation. How long has that exact chain that you just described been in place? Is that new this year in 2025?
So I would say it dates back to 2020 when we revised our departmental policy. And we do have statistics, if the committee is interested, in terms of how many cases go through that process, the percentage that reach my office. It's a small percentage, maybe 1 a month, and a very low percentage that is approved because the standard for waiving a breach of a service obligation is very high. It's stipulated in law as repayment would be against equity and good conscience or not in the best interest of the government. And when we are paying individuals and they are not upholding their end of the agreement, that is something that we want to pursue.
Yeah, that too. Thank you. My time has expired. I'm sure that we will have a second round of questioning, but I will yield to our ranking member.